Don't get a surprise from Covered California in the new year. Check your account. Hello, I am Kevin Knaus with InsureMeKevin.com, and open enrollment period going from the current year into the next is always a tricky period for Covered California and the health plans. There's a lot of things that are moving around, and you want to check your account to make sure that everything looks good for 2024, because sometimes there are surprises that you didn't know about. Maybe you didn't receive the letter in the mail. So it's really good to go through and check your account. For instance, people who enrolled into Covered California with an effective date of November and December will not have their accounts passively renewed or automatically renewed for the new year. It appears that Covered California sets up that passive renewal sometime in September with those existing accounts. So if you applied in October, you may not be automatically renewed from my experience. And so when you go into your Covered California account, it'll say for 2024, it'll say apply now. And you're thinking, well, I did apply. I am enrolled. However, you need to push through the enrollment for 2024 and select a plan again. But all of the information should be there. You really shouldn't have to enter too much new income or information or anything like that, but you will want to go through and check that, make sure everything does look good. Now, I did enroll one individual in October, and that's how I kind of learned about all this, because he wasn't automatically renewed for the new year, and I was checking his account and he lost his subsidy. So in 2023, his enrollment, he was receiving a $400 subsidy to lower his health insurance. The 2024 enrollment, there was no subsidy, APTC, Advanced Premium Tax Credit. And it's like, wow, what's going on with that? Check the eligibility results, and it showed that the financial help had been discontinued. That's the subsidy. And the detail description was that it showed that somewhere he had Medi-Cal coverage. That's perplexing. There was nothing on the account. We were never alerted. Possibly, it's Medi-Cal in another county. Regardless, because his name or social security number came up in some sort of Medi-Cal database that Covered California picked up on, they could not advance him the subsidy for 2024. So I've alerted him to that, and now he's got to start making phone calls to find out what's going on, work with the county to have that flag or aid code or whatever it is removed so Covered California can apply the subsidy in the new year. And that needs to happen before the month, the first of the month, because Covered California, it's very difficult to do retroactive subsidies within the Covered California system. Other people will go through and maybe they didn't get the letter, it's still pending. You want to check because you want to make sure that your dependents aren't erroneously put into Medi-Cal. So in this particular family, two of the dependents are pending Medi-Cal, and it's like, wow, what's going on? And oftentimes what is happening is it has to do with the income, and the income in the current year does not necessarily transfer over to the new year, especially if one of those income streams was discontinued or ended in the middle of the current year. So in Jennifer's case, she had an income from two different organizations, and her 2023 income totaled $21,605. But that Butterfield's income, that ended in August, so it will not roll over into the new year. So just based on her current income from Hawks, her annual income is $16,794, and she's well within the Medi-Cal territory. Now, she may have had another income stream that just didn't get added, or the end date to the Butterfields was incorrect, but that's something she needs to get in there, and you need to update it if it was erroneously stopped. Covered California, you can call them or work with your agent to adjust that income stream to make sure that the income for the next year is current. However, If you or your dependents are pending Medi-Cal, you can't really make any changes to the Covered California account. You need to call the county and have them update that income information. So it gets even a little bit trickier if the county and Medi-Cal is involved. But you want to go into your Covered California account. You know, the default is the upcoming year, or 2024 right now, and you can look at that, scroll down the page. If you see little red dots by the household members, that means there's some sort of action, there's some sort of verification request that is being asked of from Covered California, so you'll want to check that. Sometimes the alert is just choose a plan. You can go down and review your application, and when you review your application, you don't have to worry, you can't change anything, you're just looking at the data that is in the system. You can look at the eligibility results to try and figure out what's going on. You can kind of dig into the details, and if you click on Enrollment Dashboard, it will bring up the new enrollment, the health plan that you have selected, and potentially, hopefully, the subsidy that is being applied. And if there is no subsidy being applied, you want to get on the horn and start resolving that as well. So again, open enrollment is a very tricky time for Covered California and the health plans, and there can be surprises, but if you get into your Covered California account, work with your agent, you know, double check it, make sure everything looks smooth for the new year, you won't have any surprises. And that's what we want when it comes to health insurance. No surprises. So for insuremekevin.com, I'm Kevin Canals.